Some of the most dangerous skin cancer starts as a spot that looks harmless. And by the time many people worry about it, that tiny spot has already changed. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. Over the years, one pattern keeps showing up again and again. People do notice changes on their skin, but they often brush them off. They say, "It's just a mole." Here's the thing. Sometimes it is just a mole, but sometimes it is melanoma, which is the deadliest kind of skin cancer. Today, I'm going to show you the simple signs that help you tell the difference, what most people miss, and when you should get checked. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think melanoma always looks like a big, dark, scary mole. But actually, it often starts as something small, new, or just plain odd. Not always dramatic, but different. Not always black, but changing. And this matters more than you may think. Early melanoma is highly treatable. In the United States, the 5-year survival rate is about 99% when melanoma is found early. But that number drops sharply once it spreads. So this is not about staring at every freckle in fear. It is about knowing what deserves attention. A 2022 study from the University of Pittsburgh Medical Center found that people who were screened for skin cancer were 160% more likely to be diagnosed with stage 0 melanoma and 80% more likely to be diagnosed with stage 1 melanoma. In plain English, that means skin checks help catch trouble sooner, not later. And let me be clear about one more myth. Many people think melanoma usually grows out of an old mole they have had forever. But a large share of melanomas start on skin that looked normal before. So if you only watch the moles you already know, you may miss the new spot that matters most. Have you ever noticed a mark and thought, that wasn't there before? That thought alone is worth taking seriously. Number 5, the new or changing spot. Most people think a harmless mole has to stay harmless forever, but actually, the biggest red flag is change. A normal mole usually keeps the same shape, color, and size for years. Melanoma often does the opposite. It changes like a stranger moving furniture around in your living room while you sleep. One month it looks flat, next month it looks darker, then it seems wider, then it starts itching. That pattern matters. So what should you do? Pick one day each month. Many people use the first day of the month. Stand in a bright room with a full mirror and a hand mirror. Look at your face, ears, chest, belly, arms, hands, legs, feet, back, buttocks, and scalp. Yes, your scalp too. Part your hair with a comb or blow dryer. Check between your toes and under your nails. If you have a partner, ask for help with your back and scalp. If you live alone, use your phone camera to take pictures. Then compare. Is a spot bigger than it was last month? Darker, rougher, raised? Does it have a new color? That is the clue. Not just old, but changing. Not just there, but evolving. A 2022 study from Rutgers Cancer Institute of New Jersey, with researchers from Michigan State University and the University of Virginia, found that people using a digital skin check program were much more likely to do a thorough skin exam. About 32.6% checked all 15 body areas, compared with only 7.1% in usual care. That tells you something important. Most people do not check carefully unless they have a simple system. And one more thing, no food can diagnose a mole. But if you want to support healthy skin, start simple. 1 cup of strawberries gives about 85 milligrams of vitamin C. 1 ounce of almonds gives about 7 milligrams of vitamin E. Those nutrients help normal skin repair itself. They do not replace a doctor, but they support your skin while you learn what is normal for you. But wait until you see number 4, because this next sign catches the spots that fool almost everyone. Quick question. Have you ever noticed a spot that looked different from your other moles? Comment yes or no below. Number 4, the ugly duckling. This may be the easiest trick in the whole video. Most people think they need to memorize every detail of every mole. But actually, your skin often gives you a pattern. Many harmless moles on the same person look like cousins. Similar color, similar size, similar shape. Then one mole shows up and looks like it does not belong. That one is the ugly duckling. Think about a choir. If every singer is on the same note, one wrong note jumps out. Your skin can work the same way. The spot that does not match the rest may matter more than the spot that is simply a little dark. This is especially helpful if you have many moles. Instead of asking, "Is this mole perfect?" Ask, does this mole fit in with the others? Is it much darker, much pinker, taller, wider? Is it standing alone when everything else looks similar? That mismatch is worth attention. A 2021 study from Harvard University and MIT used the ugly duckling idea in a smart screening system. The researchers found it could identify suspicious pigmented skin lesions with about 90% accuracy and matched the consensus of 3 dermatologists 88% of the time. That does not mean you need a machine. It means the ugly duckling idea is real. Even experts use it. So here's your step-by-step move. When you check your skin, do not zoom in first. Step back. Look at groups of moles together. Look at both arms side by side. Look at both legs. Look at your chest or back as one picture. Which spot does not match the rest? Circle that mentally. Then zoom in. Take a photo. Measure it with a small ruler. If it looks odd and stays odd or starts changing, call a dermatologist. And since people always ask, no, there is no magic food that makes an ugly duckling go away. But skin health still matters. 3 ounces of salmon gives you roughly 1,000 to 1,500 milligrams of omega-3 fats, depending on the type. Those fats support normal skin barriers. Again, not diagnosis, not treatment, just support. But number 3 is even more powerful because this is the classic tool doctors want you to know. Number 3, the ABCDE rule. Most people have heard of this, but few use it the right way. They hear the letters once, forget them, and move on. But this tool can help you slow down and look with purpose. A is for asymmetry. That means one half does not match the other. Imagine folding the spot in half. Do both sides line up? A normal mole is often balanced. A suspicious one can look lopsided. B is for border. That means the edge. A common mole often has a smooth, clean edge. Melanoma may have jagged, blurry, scalloped, or uneven edges. Think of a cookie cut with a dull cutter instead of a clean circle. C is for color. A harmless mole is often one main shade. Melanoma may mix colors like brown, black, tan, red, white, blue, or pink in the same spot. One color is calmer. Many colors are louder. D is for diameter. The usual warning line is about 6 millimeters, or the width of a pencil eraser. But here's the thing. Do not wait for a spot to get that big. Some melanomas are smaller. E is for evolving. This is the most important one for many people. Evolving means changing over time. New size, new shape, new color, new itching, new bleeding, new crusting. A 2023 case report from Oregon Health and Science University showed why size alone can fool you. Their team detected a melanoma that measured just 0.65 millimeters. That is tiny, almost invisible. So not just big, but changing. Not just dark, but suspicious. Here's how to use ABCDE at home. Pick one spot. Look at it for 10 seconds. Ask the 5 questions out loud if you need to. Is it even on both sides? Is the border smooth? Is the color one main shade? Is it growing? Is it changing? If 2 or more answers worry you, do not guess. Get it checked. And yes, people ask about food here too. Food cannot tell you whether a mole is asymmetrical. But if you want another skin-supporting option, one medium sweet potato gives you well over 100% of your daily vitamin A in the form of beta-carotene. That helps normal skin turnover. Helpful for skin health, not a substitute for a biopsy, which is when a doctor removes a small sample to test it. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, the signs you can feel, not just see. Most people think skin cancer is silent, but actually your skin sometimes talks to you. It can itch, it can sting, it can become tender, it can crust, ooze, or bleed. A spot may feel rough like sandpaper or firmer than the skin around it. Have you ever touched a spot and thought, that just feels different? Pay attention to that. This matters because some people only watch for color. But melanoma is not always about color. Sometimes the clue is sensation. A sore that does not heal. A mole that keeps getting irritated. A spot that bleeds after the lightest touch. Now, one bleed does not always mean cancer. You can nick a mole with a towel or razor. But repeated bleeding, crusting, or a wound that will not heal needs a closer look. A 2021 study approved through Harvard T.H. Chan School of Public Health and McGill University found something striking about nodular melanoma, which is a fast-growing kind of melanoma. It causes only about 14% of invasive melanoma diagnoses, yet accounts for 43% of melanoma deaths. The same study found that only about 20% of nodular melanomas were diagnosed while still thin. compared with 90% of superficial spreading melanomas. Why? Because these dangerous spots can break the usual rules. Some patients in that study described tiny dot-like spots that changed fast over just 2 weeks. Others noticed puffiness, a raised feel, or simply that the spot did not feel right. That phrase matters. Your skin may whisper before it screams. So what should you do with a spot that itches, bleeds, or feels wrong? First, do not pick at it. Do not scratch it raw to see what happens. Second, take a clear photo with good light. Third, note the date. Fourth, watch it for a very short window, about 1 to 2 weeks, only if the change was clearly from irritation. If it keeps bleeding, growing, crusting, or feeling strange, schedule an exam. For general skin support, 1 cup of plain Greek yogurt gives you about 15 to 20 grams of protein. Skin is built from protein. If your meals are light, that can help your body maintain tissue. But let me say it again. Protein cannot rule out melanoma. Only an exam can do that. And number 1 may surprise you most of all because these are the melanomas that break the rules and get missed. Number 1, the rule breakers. Most people think melanoma has to be dark, ugly, and obvious. But some melanomas are pink. Some are skin-colored, some show up under a nail, some appear on the sole of the foot, the scalp, or the back, some are small, some rise quickly like a tiny bump. These are the rule breakers. This is why a spot can fool smart people. You are looking for a dark pancake, but the danger shows up as a pink pebble. You are watching your forearm, but the real problem is hiding on your scalp. You are focused on old moles, but the melanoma is brand new. A 2021 study from Harvard and McGill also found that patients with thin nodular melanoma often noticed white, blue, or black color, fast shape changes over 2 weeks, and a raised or puffy texture over 6 to 12 months. Some were tiny, like dots. So if you are only looking for a large pencil eraser spot, you may miss the one that matters. And remember what the American Cancer Society and major skin experts keep warning about. New spots in adulthood deserve attention. A mole that changes deserves attention. A spot that looks different from all the others deserves attention. Not because every spot is cancer, but because waiting is a bad strategy when change is happening in plain sight. So check the commonly missed places: your scalp, your back, the backs of your legs, the soles of your feet, between your toes, under your breasts, under your nails. If you get regular haircuts, ask your barber or stylist to mention any unusual scalp spot they see. That one habit could help more than you think. For skin-supporting nutrition, 1 hard-boiled egg gives you about 6 grams of protein and small amounts of zinc and selenium. 3 ounces of lean beef gives you around 4 to 5 milligrams of zinc. Zinc supports wound healing. But again, if a spot is not healing, do not try to feed it away. Get it checked. I'd love to hear your story. What made you click on this video today? Share in the comments. Let's pump the brakes for a second. I'm not saying this to scare you, but I do want to keep this responsible. Not every odd-looking spot is melanoma. Seborrheic keratoses, cherry angiomas, age spots, bruises under nails, and irritated moles can all look strange. On the other hand, not every melanoma looks dramatic. That is why guessing at home has limits. Also, there are a few situations where you should have an even lower threshold to call a doctor if you have had melanoma before, if a close family member had melanoma, if you have many unusual moles, if you had lots of blistering sunburns earlier in life, if you take medicines that weaken the immune system, if you had an organ transplant, if you have trouble seeing your skin clearly because of poor eyesight or limited movement. In those cases, monthly self-checks help, but professional checks matter even more. And please do not try home removal tricks. Do not burn it, freeze it, cut it, or scrub it with acid products from the internet. That can delay diagnosis and cause infection or scarring. If a spot bleeds once because you scratched it, watch it. If it keeps bleeding, crusting, growing, or changing, do not wait. If you see a new dark streak under a nail, a sore that will not heal, or a spot that changes quickly over days to weeks, call sooner. So you're convinced but thinking, how do I actually do this? Keep it simple. Pick 1 day every month for a 5-minute skin check. Use a full mirror, a hand mirror, and your phone camera. Start at the head and move down. Compare old photos with new ones. If a spot is new, changing, ugly duckling different, or breaking the rules, book an appointment. If money is tight, start with the easiest low-cost tools. Good light, 2 mirrors, a cheap ruler, a notes app on your phone, a trusted partner, friend, or family member to check your back and scalp. If you do not have help at home, ask your barber, hairdresser, or even your primary care doctor to look at hard-to-see spots during routine visits. Look, there's a lot of noise out there. You do not need to memorize every rare skin condition. You just need to remember the big idea: new, changing, different. That is the pattern. You don't need to overthink this. Start with just one monthly skin check and one clear photo of any spot that worries you. Your body will tell you if something is changing, Sean, if you actually stop and look. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.